Hello everyone, now let us discuss about CPT coding guidelines for surgery, integumentary system part 5. In the current session, we will be focusing on excision, nails, pilonidal cyst and introduction topics. First coming to excision. Excision is of two types, benign lesion and malignant lesion. Excision of benign lesions and excision of malignant lesions. Now coming to excision of benign lesions. Excision is defined as full thickness, that is nothing but through the dermis. Excision is defined as full thickness removal of a lesion including margins, and it includes simple closure whenever performed, and even local anesthesia is included. Excision of benign lesions includes simple closure and local anesthesia. Report separately each benign lesion excised. For each benign lesion excised, you need to report 1 unit of that particular code. Code selection is determined by measuring the greatest clinical diameter. Code selection is determined by measuring the greatest clinical diameter of the apparent lesion plus margins required for complete excision. In simple words, the diameter of the lesion, entire diameter of the lesion, but plus the narrow margins. Margins must be narrow. Entire diameter of the lesions plus most narrow margins required for complete excision are taken into consideration for the code selection. And the excised diameter is same whether the surgical defect is repaired in a linear fashion or it is reconstructed. That is using a skin graft. The closure of the defects created by incision, excision or trauma may require intermediate and complex closures. Usually the excision of either it is benign or malignant lesions, it includes simple closure. So whenever excision of benign or malignant lesions are done, simple closure need not be reported again because that is included. But when the closure of defects created by incision or excision or trauma, when they require intermediate or complex closures, the repair by intermediate or complex closures should be reported separately. You should not report simple closure, but repair by intermediate or complex closures should be reported separately if they are performed to correct the defects of excision of benign lesions. For excision of benign lesions requiring more than simple closure, that is if they are requiring intermediate or complex closure, report 11400 to 11446 in addition to the appropriate intermediate or complex closure CPTs. Reconstruction closure can be seen in the code range of 15002 to 15261 and another code range is 15570 to 15770. For excision performed in conjunction with adjacent tissue transfer, this is an important point. For excision performed in conjunction with adjacent tissue transfer, report only adjacent tissue transfer codes. We will discuss about this adjacent tissue transfer when we discuss about the repair. As of now, whenever intermediate or complex closure is done along with excision of benign lesions, you need to report those codes. But when excision is performed in conjunction with adjacent tissue transfer, report only adjacent tissue transfer code, that is in the code range 14,000 to 14302. Excision of lesions is not separately reported with adjacent tissue transfer procedures. Now coming to some of the examples of benign lesions. Benign lesions can be cicatricial, fibrous, inflammatory, congenital or cystic lesions. Cicatricial, fibrous, inflammatory, congenital or cystic lesions are some of the examples of benign lesions. Now coming to the CPT codes. The first code is 11400. Excision, benign lesion including margin except skin tag unless listed elsewhere. for the areas of anatomical regions of trunk, arms or legs. Excised diameter is 0.5 centimeters or less. The next code is 11401. Here the excised diameter is 0.6 to 1 centimeter. The next is 11402. Excised diameter is 1.1 to 2 centimeters. Next is 11403. Excised diameter is 2.1 to 3 centimeters. Now coming to the next code 11404. Excised diameter is 3.1 to 4 centimeters. The next is 11406. The excised diameter is over 4 centimeters. There is some observation which you can see here, especially in case of either destruction or excision codes, whether it can be benign or malignant lesion. If the fifth digit, all the fifth digits, they indicate certain specific diameter range. If the fifth digit is 4, it indicates excised diameter is 3.1 to 4 centimeters. If the fifth digit is 6, after 4 you don't have a 5, you have directly 6. Excised diameter is over 4 centimeters. Now the next CPT is 11420. If the fifth digit is 0, the excised diameter is 0.5 centimeters or less. If the fifth digit is 1, the excised diameter is 0.6 to 1 centimeter. If the fifth digit is 2, the excised diameter is 1.1 to 2 centimeters. If the fifth digit is 3, excised diameter is 2.1 to 3 centimeters. If it is 4, it is 3.1 to 4, and if it is 6, it is above 4 centimeters. So the next code is 11420. Excision, benign lesion including margins except skin tags, scalp, neck, hands, feet, genitalia. Excised diameter is 0.5 or less. The next code is 11421. Excised diameter is 0.6 to 1 centimeter. Next is 11422. Excised diameter is 1.1 to 2 centimeters. The next is 11423. The excised diameter is 2.1 to 3 centimeters. The next is 11424. Excised diameter is 3.1 to 4 centimeters. The next is 11426. Here also after 4 you have 6. 11424 indicates excised diameter is over 4 centimeters. The next range is 11440. Excision other benign lesions including margins except skin tag unless listed elsewhere. Face, ears, eyelids, nose, lips, mucous membrane. Excised diameter, because the fifth digit is 0, excised diameter is 0.5 centimeters or less. The next is 11441. Here the fifth digit is 1. So the excised diameter is 0.6 to 1 centimeter. The next is 11442. Here the fifth digit is 2. So the excised diameter is 1.1 to 2 centimeters. The next is 11443. Here the excised diameter is 2.1 to 3 centimeters. The next is 11444. Here the fifth digit is 4. The excised diameter is 3.1 to 4 centimeters. The next is 11446. The excised diameter is over 4 centimeters. The next code is 11450. Excision of skin and subcutaneous tissue for hidradenitis axillary with simple or intermediate repair. The next code is 11451. Excision of skin and subcutaneous tissue for hidradenitis axillary with complex repair. The next is 11462. Excision of skin and subcutaneous tissue for hidradenitis inguinal with simple or intermediate repair. The next is 11463. Excision of skin and subcutaneous tissue for hidradenitis inguinal with complex repair. The next is 11470. Excision of skin and subcutaneous tissue for hidradenitis perianal or umbilical with simple or intermediate repair. The next is 11471. Excision of skin and subcutaneous tissue for hidradenitis perianal or umbilical with complex repair. Now let us discuss an example. Patient has suspicious lesion of 0.2 cm diameter of the right axilla. The area was infiltrated and local anesthesia. The area was infiltrated with local anesthesia and prepped and draped in a sterile fashion. With using 3 mm punch tool, the lesion was excised and closed with 5 proline suture. Pathology report indicated that it was seborrheic keratosis. What CPT codes are to be reported? Here, it is a suspicious lesion. It is not malignant. It is benign and the diameter is 0.2 centimeters and the location is right axilla. So the appropriate CPT is 11400. Excision, benign lesion including margin except skin tag, trunk, arms or legs. Excision diameter or excised diameter 0.5 centimeters or less. Now coming to excision of malignant lesions. The rules for excision of malignant and benign lesions are almost similar except there is an additional frozen section pathology in excision of malignant lesion. So the excision is defined as full thickness removal of a lesion including margins and including simple closure and local anesthesia whenever performed. Similar to that of excision of benign lesions. It includes simple closure and local anesthesia whenever performed. Report separately each malignant lesion excised. Code selection is determined by measuring the greatest clinical diameter of the apparent lesion plus the margins, most narrow margins required for complete excision. Excised diameter is same whether the surgical defect is repaired in a linear fashion or reconstructed, that is with a skin graft. And the closure defects created by incision, excision or trauma which may require intermediate and complex closures. In such cases, you need to report the intermediate and complex closure codes in addition to the excision codes. And for excision of malignant lesions requiring more than simple closure, that is requiring intermediate or complex closure, report 11600 to 11646 series in addition to appropriate either intermediate or complex closure codes. For reconstruction closure, see 150022 to 15261. Next code range is 15570 to 15770. For excision performed in conjunction with adjacent tissue transfer, report only adjacent tissue transfer codes. Excision of lesions is not separately reported with adjacent tissue transfer codes. Now coming to frozen section pathology. When frozen section pathology shows margins of excision were not adequate. When the frozen section pathology shows margins of excision were not adequate, an additional excision or simply re-excision, an additional excision may be necessary to completely remove the tumor. And use only one code to report additional excision and re-excision based on the final widest excised diameter required to complete tumor removal at the same operation or operative session. You must report only one code by taking into consideration the final widest excised diameter required to completely remove the tumor, and to report a re-excision procedure performed to widen margins at subsequent operative sessions. Whenever the re-excision is done at a subsequent session, not on the same day, then you can report or see 11600 and 11646 codes as appropriate. But whenever re-excision procedure is performed during the post-operative period of the primary excision procedure, then you need to append 58 modifier. In other words, append 58 modifier if the re-excision procedure is performed during the post-operative period of the primary excision procedure. If the patient is within the post-op period and again re-excision procedure is done, then you need to add 58 modifier. Now coming to the various CPTs of excision of malignant lesions. The fifth digit is common, if you notice. So the first code is 11600. Here the fifth digit is 0. So excision of malignant lesion including margins, trunk, arms or legs. Excised diameter is 0.5 centimeters or less. The next is 11601. Here the fifth digit is 1. 11601 indicates excised diameter is in the range of 0.6 to 1 centimeter. The next is 11602. Excised diameter is in the range of 1.1 to 2 centimeters. The next is 11603. The excised diameter is in the range of 2.1 to 3 centimeters. The next is 1140604. The excised diameter is in the range of 3.1 to 4 centimeters. So 1 means up to 1 centimeter, 2 means up to 2 centimeters, 3 means up to 3 centimeters, 4 means up to 4 centimeters, and 6 indicates if it is over 4 centimeters. In most simplest way, fifth digit 1 indicates up to 1 centimeter, fifth digit 2 indicates up to 2 centimeter, fifth digit 3 indicates up to 3 centimeters. Fifth digit 4 indicates from 3.1 to 4, that is up to 4 centimeters. Then fifth digit 6 indicates if the excised diameter is over 4 centimeters. The next code range is 11620. Excision, malignant lesion including margins, scalp, neck, hands, feet, genitalia. Excised diameter is 0.5 centimeters or less. The next is 11621. Here the excised diameter is 0.6 to 1 centimeter. The next is 11622. Excised diameter is from 1.1 to 2 centimeters. Next is 11623. Here the excised diameter is 2.1 to 3 centimeters. The next is 11642. The excised diameter is 3.1 to 4 centimeters. The next is 11626. Excised diameter is over 4 centimeters. Now coming to the next CPT, that is 11640, which is nothing but excision, malignant lesion including margins, face, ears, eyelids, nose, lips, excised diameter 0.4 centimeters or less. The next CPT is 11641, which is nothing but the excised diameter is 0.6 to 1 centimeter. The next is 11642. The excised diameter is 1.1 to 2 centimeters. The next is 11643. Here the excised diameter is 2.1 to 3 centimeters. The next is 11644. The excised diameter is 3.1 to 4 centimeters. The next is 11646. The excised diameter is over 4 centimeters. Now let us discuss an example. Patient presents to physician for removal of squamous cell carcinoma of the right cheek. For the removal of squamous cell carcinoma of the right cheek. After the area being prepped and wrapped in a sterile fashion, the surgeon measured the lesion, documenting the size of the lesion to be 2.3 centimeters in its largest diameter. Additionally, the physician took margins of 2 mm of each side of the lesion. One layer closure or simple closure was done. The patient tolerated the procedure well. What CPT is to be reported? Here the diameter of the CPT or the lesion, the largest size is 2.3 centimeters, and additionally the margins, physician took margins of 2 mm on each side. So the total diameter is less than 3 centimeters. So the appropriate code is 11643, excision malignant lesion. Here the location is right cheek. So the appropriate code is 11643, excision malignant lesion including margins, face, ears, eyelids, nose, lips. Excised diameter is 2.1 to 3 centimeters. Now coming to the next topic, nails. Before discussing the CPTs, let us briefly discuss the anatomy of nails. So coming to nails. Nails are plates of tightly packed, hard, dead keratinized epidermal cells that form a clear, solid covering over the dorsal surface of the distal portion of the digits. They are plates of tightly packed, hard, dead keratinized epidermal cells. So every nail is composed of 3 regions: nail body, free edge and nail root. Nail body, it appears pink due to the blood flowing through the underlying dermis. Free edge appears white as no underlying capillaries are present, whereas the nail root is the portion of the nail that is bundled in a fold of the skin. Now coming to nail body. Nail body is the visible portion of the nail. It is comparable to the stratum corneum of the general epidermis, with the exception that its flattened keratinized cells are filled with harder type of keratin and cells are not shed. And the nail body, it appears pink due to the underlying capillaries flowing through dermis. The next part is free edge. Is the part of the nail body that may extend past the distal end of the digit. Next, coming to nail root. It is the portion of the nail that is bundled in a fold of skin. The whitish crescent shape of the proximal end of the nail body is called as lunula. The whitish crescent shape of the proximal end of the nail body is called as lunula. In other words, little moon. Now, beneath the free edge is the thickened region of the stratum corneum called as hyponychium. Beneath the free edge is the thickened region of the stratum corneum called as hyponychium. Hypo means below, onchi means nail. Hyponychium is also called as nail bed, which secures the nail through the fingertip. The next is eponychium. Eponychium or cuticle is the narrow band of the epidermis that extends from and adheres to the margin of the nail wall. It consists of stratum corneum. Eponychium consists of stratum corneum. The proximal portion of the epithelial deep to nail root is the nail matrix. The superficial nail matrix cells, they divide mitotically to form new nails. These are some of the anatomical points regarding nails. So this is the diagrammatic representation. This is the entire nail. This is free edge. The top one is the free edge, the next is the nail body, and the next is the nail root. This line, crescent shaped white area is nothing but lunula. And this is nail body. This is usually pink in color due to the blood flow through capillaries through the underlying dermis. This is the free edge and this is the nail root. Now coming to the various CPTs. The first CPT is 11719. Trimming of non-dystrophic nail, any numbers. The next is 11720. Debridement of nails by any method 1 to 5. The next is 11721. Debridement of nails 6 or more. The next is 11730. Avulsion of nail plate, partial or complete, simple, single. The next is an add-on code plus 11732. Avulsion of nail plate, partial or complete, simple, each additional nail plate. The next is 11740. Evacuation of subungual hematoma. The next CPT is 11750, which is nothing but excision of nail and nail matrix, partial or complete. Example, ingrown or deformed nail. For excision of nail and nail matrix, partial or complete, for example, ingrown nail, permanent removal is given by the CPT 11750. The next is 11755. Biopsy of nail unit. Example, plate, bed or matrix, hyponychium, proximal or lateral nail folds. The next is 11760. Repair of nail bed. The next is 11762, which is nothing but reconstruction of nail bed with draft. The next is 11765, wedge excision of skin of nail fold. For example, ingrown toenail. Now let us discuss an example. Joe has a terrible problem with ingrown toenails. What does the podiatrist have to do with the nail removal along with the nail matrix? What CPT is reported? Here, nail is removed along with the nail matrix for the treatment of ingrown toenails. The appropriate CPT is 11750. Excision of nail and nail matrix, partial or complete. For example, ingrown or deformed nail, permanent removal. Now coming to next topic, pilonidal cyst. What is pilonidal cyst? It is an abnormal skin growth located at the tailbone that contains hair and skin. Now the various CPTs of pilonidal cyst are 11770. Excision of pilonidal cyst or sinus, simple. The next is 11771, which is nothing but excision of pilonidal cyst or sinus, extensive. The next is 11772, excision of pilonidal cyst or sinus, complicated. Let us discuss an example. Patient presents for excision of simple pilonidal cyst and the excision is closed in only one layer. That is, simple closure is done. What appropriate CPT is reported for this procedure? The appropriate CPT is 11770. which is nothing but excision of pilonidal cyst or sinus simple. Now coming to next topic, introduction. Now coming to the CPTs of introduction. The first one is 11900, which is nothing but injection intralesional up to and including 7 lesions. The next CPT is 11901, injection intralesional more than 7 lesions. The next is 11920, tattooing intradermal introduction of insoluble opaque pigments to correct color defects of skin, including micropigmentation. Area is 0.6 square centimeters or less. The next is 11921, tattooing intradermal introduction. Area is 0.6 to 20 square centimeters. The next is an add-on code plus 11922 for each additional 20 square centimeters or part thereof. The next is 11950, subcutaneous injection of filling material. For example, collagen 1 cc or less. Subcutaneous injection of filling material 1 cc or. The next CPT is 11951, which is nothing but subcutaneous injection of filling material. Example, collagen 1.1 to 5 cc. The next is 11952, subcutaneous injection of filling material. Example, collagen 5.1 to 10 cc. The next is 11954, subcutaneous injection or filling material. For example, collagen over 10 cc. The next CPT is 11960, insertion of tissue expander for other than breast, including subsequent expansion. The next is 11970, replacement of tissue expander with permanent implant. The next is 11971, removal of tissue expander without insertion of implant. The next CPT is 11976, removal implantable contraceptive capsules. The next is 11980, subcutaneous hormone pellet implantation. Implantation of estradiol or testosterone pellets beneath the skin. The next is 11981. The triangle indicates it is a revised code. Insertion drug delivery implant. For example, bio-erosible, biodegradable and non-biodegradable. Insertion of any drug delivery implant is given by 11981. The next is 11982, removal non-biodegradable drug delivery implant. The next is 11983, removal with reinsertion non-biodegradable drug delivery implant. Now let us discuss an example. The patient is here for follow-up of keloid excised from his neck November of last year. He believes it's coming back. He does have a recurrence of the keloid on the superior portion of the scar. Because the keloid is still small, options of injection or radiation to the area were discussed. It was agreed our next course should be a Kenalog injection. Risks associated with the procedure were discussed with the patient. Informed consent was obtained. Area was infiltrated with 1 cc of the medication. This was a mixture of 1 cc of Kenalog 10 mg and 0.5 cc of 1% lidocaine with epinephrine. He tolerated the procedure well. What CPTs are to be reported? So here injection is done and the drug is Kenalog injection. For that, the appropriate CPT is 11900, injection intralesional up to including 7 lesions. The next is HCPCS code J3301. HCPCS code for injection of triamcinolone acetonide, which is nothing but Kenalog, not elsewhere classified, 10 mg. By this we conclude the introduction CPTs. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.